Hi everyone, it's Dr. Sharon in the back of Uber on my way to a gala celebrating advances in women and heart disease. Ergo the red, you all should see my post. I bleed pink and green, but tonight red, you know, it's heart disease, whatever. But so to my Delta sisters, shout out. That's all right. But to my Soras of Alpha Kappa Alpha, you know the deal. This is fuchsia. That's what it is. But since I'm on my way to a gala, and it's by WomanHeart in DC, I wanted to just take a few minutes really quickly to talk about heart disease in women. If you saw my last video, hi Cynthia Bird, my line sister. If you saw my last video, and please go to my YouTube channel or look on Facebook, whatever. I talk about heart disease and stroke also in women because often, you know, a lot of my recent stuff, Hi Pastor Boom talked about heart disease, stroke in men, given some recent deaths. However, it has to be noted that heart disease remains the number one reason. Hi Maggie Green, thanks for the compliment. The number one reason why we will leave this earth is heart disease. As men, women, we're even seeing some heart attacks in children. How do we, and what is heart disease? And I'm sorry, I'm in the back of a car, but you know, I multitask. So heart disease is, number one, we have to talk about hypertension. Hi Mary Hill. We have to talk about hypertension. We have to talk about cholesterol. We have to talk about atrial fibrillation and irregular heartbeats. When you see people grab their heart and just drop dead on the floor, usually that's a massive heart attack, or more importantly, an arrhythmia. Arrhythmia just means your heart gets out of rhythm. That's why many facilities have AEDs and things to shock people back into rhythm. So, and just by the way, if your school, your church, your facility does not have an AED, they need to have one. So again, on my way to the WomanHeart Gala, where we're going to celebrate the advances. Hi, homegirl Tammy, in heart disease for the last year. So always a wonderful event, and honoring pioneers in the area of heart disease. So prevention, prevention, prevention. Low sodium, exercise, know your numbers. Your blood pressure should be less than 120/80 at all times, even if you are diagnosed with heart disease. Total cholesterol should be well under 200. Good cholesterol should, and I'm doing this off the cuff, so if I'm a little bit off, y'all forgive me, I'm rushing a little bit. So good cholesterol, you want to shoot for over 75. Bad cholesterol, you want it to be less than 80. We change those guidelines a lot. I have a lot of events coming up. Certainly hope to see women in Fort Washington, Maryland. Look at my page from yesterday at the Ebenezer God is a Wonder retreat. We're going to talk about how we make sure we don't drop dead of a heart attack, but more importantly, how we change the life of our family around heart disease and all that. I'm in the car trying to keep this together. And so it really is important. I also want to give another shout out. Tammy, you're in North Carolina. I will be at Winston-Salem State University doing a men's health symposium that's open to men and women, and have a special session for women. All I ever did was love a man, telling you how to keep yourself together, but also help the men in your life stay together. So I'm in the back of the car, all crazy. Hi Yolanda, Dr. Lindsay. Any questions for me? I talked about less than 120/80, talked about heart disease being the number one killer. We're actually seeing heart disease in pregnancy. So women having heart attacks while pregnant. We have some serious issues in this country and some serious stuff. Hi, Latoya Vines. I will be in North Carolina. I think, Latoya, you may be in North Carolina. Y'all come see me in Winston-Salem on June 8th. But we really have to make sure. It is June 8th, Tammy. Winston-Salem, bring up the people. Winston-Salem State. It's going to be so much fun. And I'm doing like 3 sessions, or I'll be there all day. But heart disease, again, the leading reason why men, women, will leave this earth worldwide is heart disease. And on my way again to the WomanHeart Gala, really committed to heart disease, but you know, I'm committed to trying to educate, push people to live their best lives. Heart disease, what do? Know your numbers. Less than 120/80 blood pressure. Cholesterol needs to be lower. Also, oh, one thing I need to talk about that I'm incorporating into my spring talks, aspirin. There's a new study. For years we have all said that you take a baby aspirin every day after you get a certain age. Talk to your doctor, because we have changed those guidelines. Talk to your doctor. And it is shown that the long-term studies are not necessarily showing that everyone benefits from aspirin therapy. So that's a tip. And that's a heart disease tip. But again, this is Dr. Sharon Allison-Ottey. Y'all go subscribe to my YouTube channel. Look at the last videos. Holla at your girl. Always, always, always. Hi. Always. I was just talking about Ebenezer, Maria, in the women's conference. Always, always, always know your numbers. If you're taking medication, take the medication as prescribed. But also put down the salt shaker. Get away from some of those high-fat foods. Exercise, exercise, exercise. Not just to lose weight, if you need to do that, but exercise to get your heart. Your heart is a muscle. When you exercise the heart, and the heart is this big, it's not supposed to be bigger than a fist. When you have high blood pressure or get congestive heart failure, that heart has to work hard. It gets bigger and it gets floppy. Okay, you all share this on your page. Do a little shout out. Tell people, hey, homegirl Sherry. Dr. Sharon said, hey, Tanetta. Oh, my people are all coming on. I'm on my way to WomanHeart, Tanetta. You know that well. So it's going to be a great night. Again, celebrating the advances in women's heart disease and some pioneers. 200, less than 200 on cholesterol. Okay, suggestions: if you don't do salt, only use extra virgin olive oil. Tammy, know your family history. It may be hereditary. Bump up your exercise. I know that you are slim. Bump up your exercise and start looking really hard at food for cholesterol. Some things we don't think about. Mayonnaise, cut it out 100%. Think about it. Mayonnaise is just egg yolk, right? So those kind of things. If you have steak, make sure you cut off all the fat that you see. Okay? All right. You all have a good day. I'm almost here, and this has been a bumpy ride. Woo! Bye-bye.